Welcome, everyone, to the AARP Community Education Program. I'm a volunteer, Rob, and I will be talking about the ABCDs of Medicare. Now, specifically, let's talk about open enrollment. But first, we have some good news with both Medicare and Social Security. Medicare premiums will actually decrease by about $5, and perhaps more importantly, for many people, insulin copayments will be capped at $35 a month, and the Part D donut hole is now gone, and prescription drug costs, once you reach the catastrophic stage, will be $0 beginning in 2024. Importantly, Medicare will now be able to negotiate prescription drug prices, and prices are expected to go down as a result. And finally, Social Security for 2023 will be increased by 8.7%, which is far and away the largest increase in decades, and the average benefit is approximately $146 monthly. Now, Medicare today, open enrollment has begun as of October 15th, and it will continue through December 7th. Now, check your mail because you should be receiving important information from both Medicare and Social Security regarding coverages and changes in those coverages. And this information is really critical to any decisions you might make about open enrollment. You also should have received your 2023 Medicare and You handbook. And this talks about Medicare coverage in the coming year, as well as prescription drug plans. Now, if you're satisfied with your current plan, there's no need to take any action. You will simply continue with the coverage you have. Now, if you're uncertain, there is personalized help that you can receive from the community, and you can receive information like today, or there are Medicare counselors in the area available by phone, and also the State Health Insurance Assistance Program, which is run by the Area Agency on Aging. Now, today, our objective is to discuss some basic information on Original Medicare and Medicare Advantage. Topics are who qualifies and how Original Medicare and Medicare Advantage compare. And then we will get into a more detailed comparison between the two alternatives. Unlike Social Security, where you can qualify as early as age 62, you must be 65 or older and have accumulated 40 credits, which is equal to 10 years of employment. Also included are any people that are covered by Social Security disability insurance for at least 2 years, and anyone with end-stage renal failure. Medicare has two options, Original and Medicare Advantage. Now, they both consist of 3 parts. Original Medicare has hospital insurance, as does Medicare Advantage. Part B for both plans is medical insurance, but the medical insurance is optional with Original Medicare. And if you change your mind later on, there may be a penalty involved. Part B is included with Medicare Advantage. And Part D, prescription drugs, again, is optional with Original Medicare, and it's included with Medicare Advantage. Okay, let's compare the two plans in more detail. First of all, Original is a fee-for-service plan, and Medicare Advantage is what is called managed care through health maintenance organizations. Now, with Original, you have a choice of providers who accept Medicare. With Advantage, you are working with network doctors and hospitals, and in some cases, specialist referrals will be required. With Original, there is no out-of-pocket limit. With Medicare Advantage plans, there is an out-of-pocket limit, and that can change yearly. With Original Medicare, Part B is purchased, and with Medicare Advantage, Part B is included. Part B with Original Medicare includes a 20% co-insurance charge, and with Medicare Advantage, Part B involves co-payments, which are typically less than the co-insurance. Part D is purchased with Original Medicare, and in most cases, Part D is included in a Medicare Advantage plan. Now, this next point is important to a lot of people because with Original Care, you may also purchase a Medigap policy, which is referred to as a supplemental policy, and this can cover many of the costs. Medicare Advantage cannot be combined with a Medigap policy. And some plans, and there are quite a variety of plans available around the country, but some plans do have an additional premium. Resources available to you is the State Health Insurance Assistance Program. And when you go to this website, it'll ask for your state name, and it will then lead you to the area agencies on aging in our region. You can interact over the internet or you can call direct. You can research more information on the Medicare website. And once again, there are people available to answer your questions in person. Access through Arizona has a website that can provide more information specific to Arizona. And again, a phone call if you need to speak with someone. And finally, there is additional information from AARP on our Medicare Q&A website, or you can call this number to speak to someone. Thank you very much, and it has been a pleasure talking with you.